The global community between 2000 and 2012 recorded 51% decrease in malaria deaths, saved 3.3 million lives, with fewer than 500,000 children dying of malaria annually. The progress recorded is as a result of increased global funding from $100 million in 2000 to $2.5 billion in 2012. But the country director of Malaria No More says more funds are urgently required to combat malaria.
Global Fund is really engaging the government, and the National Malaria Elimination Program is really making an effort to ensure that, for example, there's total net coverage, to ensure that at the state level that things are being done. It's a big country, it's a huge problem. Nigeria has a quarter of the burden. Obviously, much more can be done.
For these medical experts, there is need for continued investment, conducive environment, and sustained political commitment to malaria prevention and control.
It's political will, funding, very important, but there has to be that zeal for those of us who are medical professionals to take up the challenge of going into research. We hear every day, like in South Africa, a lot of work has been done trying to come up with a malaria vaccine. What are we doing here?
Until you address the environmental issues that has to do with malaria, which is environmental sanitation, good living environment and high standard of living, malaria solution is still far.
I recalled one of the researches we were doing. We had a freezer, we were storing samples inside. Suddenly there was a power outage and then the freezer broke down. It couldn't be replaced, so that ended that work. So some investment has to be put into research work, especially for malaria.
As malaria remains a major health challenge, Nigerians have also been urged to evolve environmental best practices to strengthen both international and national malaria control efforts. Nengi, Fine Country, AIT News, Port Harcourt.